Okay, good afternoon, everybody. It is 12 noon on Tuesday, May 25th. Hope you are all doing well after a beautiful long weekend. Thank you for joining us here today. My name is Brittany Cadence. I'm the Communications Manager at Peterborough Public Health, and we are pleased to share with you the latest COVID-19 situational report for our community. Okay, so let's take a moment and respect this beautiful place that we call home. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so to start us off today, our board chair, Mayor Andy Mitchell, is with us. So I will hand it over to you, Mayor Mitchell. Please go ahead.
Thanks, Brittany. Last week, the province presented its roadmap to reopening. The three-step process outlines a series of ever-expanding reopenings based on the percentage of Ontario adults who have been vaccinated. It is a much-needed strategy. However, it will be important that more details be provided in the days ahead. Key questions that will need to be answered include: when and will schools reopen? And will there be new additional protocols in place? Will the stay-at-home order end as planned on June 2nd? Or will it remain in place until step 1 is implemented? Will permitted activities in each stage be adjusted according to health metrics, like case numbers, positivity rates, hospitalizations, and ICU capacity? Are regional variations across the province and the associated risk to be considered? Although the government, in consultation with health experts, will need to make additional evidence-based details available, our short-term strategy is clear. Vaccinate as many people as we possibly can. Our case numbers are being driven by younger age cohorts. These individuals are now eligible and should seek appointments as soon as possible. Peterborough Public Health and our partners continue to provide additional appointments as vaccine supplies are confirmed. Limit your contacts to essential purposes. Large events, social gatherings, and crowds should be avoided. And continue to practice basic public health measures. Maintain a physical distance of 2 meters when with others outside of your household. If not possible, wear a mask. Wash your hands frequently. And if you are ill, stay at home and get tested. It's been a long journey, but we are getting there. This week, I saw pure joy as my wife could, after months apart, once again see her mother in her care facility. I hope that each successive week will see more of the simple things that make life special return for everyone. Normalcy will bring us strength, renewal will bring us hope, and love will bring us joy. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very, very much, Mayor Mitchell. Okay, so I will now invite our Medical Officer of Health, Dr. Rosanna Salvaterra, to share the latest in terms of our local statistics. Please go ahead, Dr. Salvaterra.
Thanks very much, Brittany. Well, we had a great long weekend with only single-digit increases in new cases each day. So our active case count now stands at 89, and that's down by 20 since Friday. We continue to see the B117 as the dominant strain circulating in the communities. And just a reminder that this is more transmissible than the original version of the virus. The number of close contacts has also declined by 50 to 324, but still remains high. We'll look at the weekly incidents. And here you can see, so far we've only had 2 cases reported this week. And it's good to see that the case count for last week did land at 67 cases following the previous week's high of 91. So hopefully this means that the third wave has crested, although again, it's too soon to say as we have yet to see the effect of this past long weekend's activities. But at this point, it's looking promising. Next slide, please. Here are the monthly totals, and you can see that the case count is standing at 230 so far this month with a week to go. This now exceeds the month of March, where we reported 225 cases for that entire month. So May isn't as good as we had hoped, but hopefully it'll be less than April. Next slide, please. We continue to see slightly more men than women infected. And since last Tuesday, we're reporting another 12 cases among the 20 to 29-year-olds and another 15 cases in those that are under 20. With the expanded eligibility of Pfizer vaccine to people as young as 12, I'm hoping that we will start to see these individuals protected soon with immunizations here in Peterborough. Next, we'll look at exposures. Over the past week, we can see that the sources of exposures have remained fairly consistent. Just over 3/4 or 76% are from close contact, and community spread has dropped a bit to 18.6%. Cases exposed through travel are still occurring, although at a much lower rate. So great, Peterborough, good time to stay home and stay local. Next slide, please. This past week, another 550 people were tested for the first time, bringing our total to just over 52,000, or 1/3 of our population that's been tested at least once for COVID-19. As far as active outbreaks, there are now 6 active outbreaks in the community. It was unfortunate to see an outbreak declared at Fairhaven on Friday afternoon. They've been busy testing all weekend. I'm happy to report that there have been no resident cases to date at Fairhaven. The only cases so far have been in staff. So I think that's an end to the dashboard. I just want to begin by sharing that I understand we have 1,400 available appointments today online for clinics scheduled June 15th and 17th. So I'm encouraging people to book. As of Sunday, anyone 12 years of age and over is eligible. And we are also hoping to have some more appointments open up, potentially at PRHC for later this week. So I advise everyone to keep checking, as we will be loading more appointments as we get vaccine supplies confirmed. So while we remain at this under this stay-at-home order, the province did release more details about its 3-step reopening framework, and I'm going to walk you through this now with some of the details. So this is the roadmap to reopening. And you can see that it is guided by both vaccination rates as well as key indicators for some of those health outcomes and indicators for spread that Andy already referred to. Step 1 in orange outlines an initial focus on resuming activities outdoors with small numbers, where the risk of transmission is lower. It also includes some reopening of retail with restrictions. So step 1 allows outdoor gatherings of up to 10 people, outdoor dining with up to 4 people per table, and non-essential retail operating at 15% of capacity. The vaccination rate to enter this step requires 60% of all adults with at least 1 dose. The province already met this target on the weekend, but we have not here in Peterborough. As of today, 56% of Peterborough's eligible population has had a first shot of a COVID-19 vaccine. And we need to remember that it takes at least 2 weeks to get the benefit of that first dose. Step 2 is shown in blue. Once 70% of adults have received their first dose and 20% are fully vaccinated with 2 doses, and no sooner than 21 days after step 1, we can expect to enter step 2. Here we will see a further expansion of outdoor activities and resumed limited indoor services with small numbers of people where face coverings are worn. In step 2, outdoor gatherings of up to 25 people will be allowed, as will outdoor sports and leagues. Indoors, personal care services where face coverings are worn will resume, as well as our public libraries. Indoor religious services, rites, or ceremonies with a 15% operating capacity will also be able to resume. Step 3 here in green requires 70 to 80% of adults to have received their first dose and 25% to be fully immunized. It will include expanding access to indoor settings with restrictions, including where there are larger numbers of people and where face coverings can't always be worn. So this stage will include a return to indoor sports and recreational fitness, indoor dining, museums and art galleries, and casinos and bingo halls with capacity limits. In addition to those vaccine rates, as I said, the government will continuously monitor our several other key public health and healthcare indicators. So for our local business operators and owners and other organizations who are currently closed due to the stay-at-home order, now is the time to review your workplace safety guidance to make sure that you are in full compliance with the legislation and are safe to open. And here are a few important measures to consider. It's essential that all staff complete their screening prior to leaving for work each day. So employers and operators can provide staff with the link to the ministry workplace screening tool. It's important that every operator and every workplace has a comprehensive safety plan, and also that PPE, personal protective equipment, be provided to staff. And that does include face shields and procedural or surgical masks if employees are public facing or cannot maintain 2 meters distance. It's important to be able to provide sick time or to ensure that employees know about sick time benefits that are available to them, and to have staffing contingency plans when employees are off ill or self-isolating so that they don't feel guilty or pressured to return too early. And it is important to ensure that physical distancing is maintained, especially during staff breaks and staff lunches. So with more people hopefully going back to work soon, Peterborough Public Health is expanding vaccine appointments into evenings as well as on weekends. Staff may ask if they can get vaccinated on work time, and we do encourage employers to consider this. It's very positive to see the provincial plan released, and I continue to urge everyone to take things cautiously and slowly so that we all can remain healthy and safe. I'm still hopeful that we may actually see a return to the classroom here in Peterborough for our students so that they can complete their academic year with their teachers and their peers. But this is a provincial decision, and we are waiting to hear news on that. So with that, I'll pass it back over to you, Brittany. Thank you.
Thank you very much, Dr. Salvaterra. Okay, so we do have some of our elected officials who have joined us here today. We have our federal and municipal representatives. So let's start with our MP, Maryam Monsef. Hopefully she's got some more good updates for us on the vaccine front, but we welcome any news you can share. Please go ahead, Maryam.
Thank you so much, Brittany. Hello, colleagues. Bonjour, Anin, salam alaikum. I'm on Mississauga and Anishinaabe territory. And I saw a lot of people out and about this weekend, and I want to thank everybody who worked really hard to follow public health guidelines, and the entire team at Public Health who had to pivot very quickly to make sure our weekend could be enjoyable outdoors. I hope, and I very much look forward to all of you taking a nice, much needed vacation when it is time. I do have some good news, and a great deal of gratitude for you, Dr. Salvaterra, and you, Chair Mitchell, and every single person on the front line of the fight against COVID. Over the long weekend, we surpassed a few significant milestones on our vaccine rollout. More than 25 million doses have now been delivered to provinces and territories, and more than 60% of adults have received their first dose. There are more than 3.5 million vaccines on hand in Canada, so we're going to see that percentage continue to rise. Many thanks to our immunizers. Canada's consistently in the top 3 in the G20 in terms of total doses administered per capita, percentage of the population with at least 1 dose, and the pace of vaccine administration. Next week, we'll start to see another increase in our Pfizer supply as we go from receiving 2 million doses to receiving 2.4 million doses. Over the weekend, we also confirmed the delivery schedule for Pfizer throughout the month of July. Starting July 4th through August 1st, Canada will be receiving 2.3 million doses weekly. This consistent supply of vaccine will continue to provide the province and local health units the stability you need to ensure a steady rollout as we approach the summer and we begin our second dose campaign. What do these numbers mean for Peterborough? I think our health officer has said it best. If the province continues with their distribution on a per capita basis, Peterborough should be receiving somewhere between 8,000 to 9,000 Pfizer doses every week, starting next week, all the way to August 1st. This is just the Pfizer shipments. The Moderna shipments will continue to be added as they are received and as that delivery schedule is cleared up. And of course, there are other vaccines for us to consider as well. I realize people are restless. We are so close. And, we're seeing some of the restrictions starting to loosen up. We're getting close to breathing a sigh of relief. Please do not take any of this progress for granted. As Dr. Salvaterra reminds us, as Chair Mitchell reminds us, progress is not victory. We're not out of the woods yet. So roll up those sleeves and get those vaccines. Talk to your loved ones who are not sure if they can go ahead with it. Encourage them to get the vaccine. The first vaccine that is available to you is the right one for you, and continue to prevent the spread of COVID so that we can check back in on Canada Day long weekend with much more to celebrate. Thanks, Brittany.
Thank you so much, MP Monsef. Great to hear from you. Okay, let's hear from the City of Peterborough, and Mayor Therrien, do you have any comments to share with the group today?
Hi, Brittany. Hi, everybody. Thank you very much. On Friday, I encouraged people to think about frontline workers and everyone who was not able to have a long weekend, to think about how our choices and actions impact them and their families, and by extension, our communities. And that's a sentiment that I'd like to encourage again, not just on the long weekends, but all the time, especially as we are moving in the right direction with regards to vaccines and reopening. The city is working with public health to make sure that we're following provincial guidelines to reopen municipal facilities when it is safe to do so. And we will certainly keep everybody posted as that plan moves forward. So in the meantime, thanks to the previous speakers for their remarks. And I would just echo what has been said. Get outside for your mental health, for your physical health, but do it in a safe way and continue to take care of yourself and one another. Thank you.
Thank you so much, Mayor Therrien. Okay, so from the County of Peterborough, we have Warden Jones with us today. And please go ahead if you've got some comments. Warden Jones.
Okay, thank you. I'll be very, very brief today. It's pretty hard to follow Miriam and Diane. I certainly echo what they've said. It was a busy weekend throughout the county. I mean, you certainly don't have a lot of numbers, but the roads were certainly busy. But I have not heard yet any super duper infractions that have gone on. So I keep my fingers crossed that we all just wait a little bit longer, and then we can start to discover what normal might be like. So we're all suffering over this. We all have to be patient. It's not just some of us suffering, but all of us. So let's do it together with the odd smile here and there. Anyway, thank you for everything everyone's doing. Let's keep our chin up, and we will get through this in real short order. Thanks.
Thank you so much, Warden Jones. Okay, so now we will invite our media guests to ask some questions of our speakers. And I'm pleased to share that some of our enforcement partners are with us today as well. We have Staff Sergeant Dan McLean from the Peterborough Police Service and Constable Joseph Ayat from the OPP. But let's start off with Bill Hodgson. If you have some questions for our speakers, please go ahead.
2 questions for Dr. Salvatierra, please. The first, just looking for some clarification. You said we're at 56%. If we don't hit 60 when the rest of the province opens up, does that mean we're going to be delayed, or does the province wait until everybody gets there?
Good question, Bill. I believe these are provincial steps. They are no longer using a more regional approach. So the whole province goes together. And as I've said earlier, the province is already at 60%. They reached that target on Saturday. So hopefully we will all go, whether we're all at 60, as long as we're at 60 together. It certainly would be best for us if we could also get 60. And I think we'll reach 60 by this weekend, according to how well we're doing right now.
Okay, and the second, just heard stories of the GTA of people showing up at clinics. I hate to use the word demanding, but sort of trying to finagle their second shots early. Have you seen that locally? And is there any sort of sense on if people have been given dates for a second shot that it might be earlier than they were given?
Well, I can't, it hasn't been reported to me, Bill. So I can't say whether or not it's happened. It certainly hasn't come to my attention. I wouldn't be surprised though if some people show up. I know, for example, for end of day doses, when we're looking for people to give that the last remaining doses to, that sometimes you get people who are hoping that they might get their second dose that way, but we are not currently administering second doses at end of day. We're still focusing on getting as many people with a first dose, and we still have thousands of people here in Peterborough who haven't had their first dose yet. So we really do need to give them a chance. As far as second doses go, though, we are expecting the province to share its plan with us this week on the sort of how that's going to happen. And we will begin administering second doses as both once we have a plan and as we get supply. I do think it's going to be earlier than the 16 weeks that that we were planning for. And I know the province is working on the booking system to allow those changes to the second doses. So I think we'll know a lot more about second doses and timing in the next week or two.
That's good for me. Thank you very much.
Great. Okay. Thank you very much, Bill. Let's hear from Rob from Trent Radio. Go ahead, Rob.
Hi, can you hear me?
Absolutely.
Yep, just had to scramble for the mute button there. So one question, just for clarification for Dr. Salvatierra. You mentioned that there was some appointments opening up at PRHC this week. Is that appointments opening up this week for later, or appointments opening up for people to be vaccinated this week?
We have submitted requests for additional mass immunization clinics at PRHC this week, later this week, and into the weekend for the general public. And so we're just waiting to see if the province is able to upload those requests, and as soon as they do, we will be opening up those appointments. So it will be 4 appointments by either occurring later this week or on the weekend, but at PRHC. So they're going to actually be taking, because up until now, we've been using PRHC for healthcare workers and for people at with highest risk health conditions. So this will be the first time that we're actually opening it up to the general public as well.
Okay, that's wonderful. Very exciting. And just another question out of like total self-interest. So I was at the clinic on Sunday, and it was a really wonderful operation. I was amazed to see that, especially on a Sunday. I got home and saw that in Toronto, there's clinics that are giving people free ice cream when they get vaccinated. Is there any plan to do that in Peterborough? And if so, would we be able to apply for it retroactively?
I think it's up to community partners. If there are partners who are interested in providing treats to people getting immunized, I think they can get in touch with us, and we'll review those proposals.
Okay, wonderful. That sounds great. All right, that's everything for me. Thank you.
Thanks so much, Rob. Makes me wish the Baskin-Robbins factory was still around.
Yes.
Okay, Matt Latour from Oldies and Freak Radio, please go ahead with your questions.
Thank you very much, Brittany. It's actually Jordan filling in for Matt today. So
hello,
great to hear from everybody. Thank you so much. I had a comment question for either Dr. Salvatierra or Constable Hyatt, who I know is on here as well. I know there was a release that was sent out Friday about some possible scams as it pertains to COVID-19 vaccinations. One, is that sort of, what are we seeing with that? And two, how can people sort of protect themselves?
I think that's a good one for our police partners. So I'll give the floor over to them.
Good afternoon. We received that information from members from the health unit. We haven't actually had anything reported to us regarding that, but we just thought we'd get ahead of the game since the health unit was receiving those complaints or things reported to them. And I believe the city police had put out some social media warnings the day prior to we did. So we haven't actually had anything reported to us, just the health unit has. But like I said, we were just trying to get ahead of the game and give everybody a warning that that's happening.
Joe, can you just give me some tips for people to avoid being the victim of fraud, even if it's generic, not just to COVID-19?
Yeah, it's same as any other fraud. Basically, don't give out any personal information online. Don't be afraid to say no or hang up. If it is actually somebody from, say a health unit, or we get a lot of them from Revenue Canada, they won't become pushy if you refuse to give them any information. So, if you're into an argument, or, it is a scam artist. We advised anybody that think they may be victim to a fraud scam, or was questioning anything, to go to the Canadian Anti-Fraud Center website. They have a list of any frauds and scams that are happening in Canada or our area. So that's the number one spot we refer to if they think they're involved in a fraud or scam.
Thank you very much. I had one more for Dr. Salvatierra. You had mentioned that you're hopeful that kids might be able to get back into the class, and we all recognize that that's going to be a provincial decision. One, why do you think that that is so important? And two, do you have any sense of what a timeline might look like for a decision like that? I know we're, slowly getting closer to June.
So I'll answer your first question. I would hope that we get at least a week's notice so that staff and parents and students have time to prepare for a safe re-entry back into the classroom. I mean, we were very fortunate here in Peterborough. Up until now, we've only had 2 school-related outbreaks in the whole year, and they were small. There were only 2 to 3 people involved in each one. So I do believe that it is safe to be in the classroom, and I would hope we can get students back at least for a few weeks before the school year ends, just so that they get some closure. As far as some of the rationale, as I said, closure would be a nice thing to have for both students and staff to be able to close the year together. But also we know that for some students, learning remotely is not the preferred method for them. And so we certainly have, I think there's a lot of questions about how well these students are learning virtually, but also that they don't get the same emotional benefits as when they're in a learning environment with their peers. So there are emotional and mental health reasons why kids need to be together. And so for all those reasons, as well as for parents who've been doing an incredible job of trying to work often as well as support the learning of their children. I think parents as well need a bit of a break, and would probably be in most cases, be very glad to see their children in school again before the end of the year.
Thank you so much, Dr. Salvatierra. Really appreciate it.
You're welcome.
Thank you, Jordan. Great to hear from you. Okay, Paul Rellinger from Kawartha Now. Please go ahead if you've got some questions.
Thanks so much, Brittany. For Dr. Salvatierra, regarding the Fairhaven outbreak, by my count, this is the 6th outbreak at Fairhaven since the start of the pandemic. And I just want to get a sense from you, is there a particular challenge at Fairhaven, or is it just bad luck?
I think it's the size of their staff, probably, Paul. I would think, again, with this latest outbreak, it's a staff person who tested positive. So I think they're doing a great job as far as screening. But they have a large staff, and that means more opportunity for people to be infected and then to come to work. I'm not sure what kind of immunization uptake they've had at Fairhaven, but that's certainly something to support, that more staff are immunized. And it may just be a bit of bad luck as well. I think they've worked so hard at Fairhaven, and sometimes, it just has felt unfair that they've had, come out of an outbreak and then had to go back into an outbreak so quickly. I think it also reflects, Paul, the fact that the definition of an outbreak for long-term care homes is very, very low. I mean, you just need one person, right, to test positive. And so because of that, we've been declaring outbreaks much sooner than we would have had in the past.
Okay, thank you for that clarification. And Mayor Mitchell alluded to this earlier, and I just wanted to get your take on it. The stay-at-home order is due to expire June 2nd. The reopening plan, stage 1, if all goes well, will come into effect the week of June 14th, according to the provincial website. There's a gap there potentially of a couple of weeks. would it be your preference that the stay-at-home order stay in effect in that interim, or what's your take on that?
Well, my take is that there's a bit of wiggle room there, and that that depending on how well we do with controlling the pandemic, that there's some flexibility as to when we can move to step one, keeping in mind that you need 2 weeks post immunization to get any protection from the vaccine. So so we need some time for after 60% has been reached. It has been reached as of May 22nd. So we know that target provincially is there. And now it's really a matter of some time for that to take effect, but also to watch those indicators for both the healthcare system capacity, as well as how we're doing with transmission, you know, cases, and to watch those to see when and if we're ready to move to step one. So I think the province has given itself a little bit of flexibility, and we may see the stay-at-home order extended if we're not doing well, or we might see step one happen sooner than anticipated if we're doing well.
Great. Thank you so much, Dr. Salvatierra. That's it for me.
Okay.
Great. Okay, thank you very much, Paul. Okay, let's hear from Joelle Kovac from the Peterborough Examiner. Please go ahead, Joelle.
Okay, I have some questions for Peterborough Police and some others for Dr. Salvatierra. Maybe I'll see if police would like to answer my perennial question about charges over the weekend. Were there any in connection with either any outdoor public gatherings like the anti-lockdown protest, which I understand was small, and I don't know if there was a church gathering. Thank you.
Hi, Joelle. It's Staff Sergeant Dan McLean. I can answer that. We had, there was approximately 30 to 40 people in front of City Hall on the weekend. That's the weekly protests that have been going on since mid-January. We're still continuing to investigate that gathering. So at this point, there hasn't been any charges. We were also made aware of another smaller type gathering at Beavermead. We did dispatch officers down to that area, but it didn't appear as though there was a really large gathering there of any significance. So as I said, at this point, we're still continuing to investigate the City Hall gatherings.
Okay, was there any, are we aware whether there was a religious gathering at all at Nichols Oval this weekend?
There wasn't any reports made to me with respect to that gathering. So at this point, I can't really say whether there was or whether there wasn't a gathering.
Okay, that's helpful. Thank you very, very much. And my question for Dr. Salvatierra was around immunization for 12-year-olds and up. I'm hearing that some of the very younger people who are being immunized are experiencing some side effects right on the spot, like that they have sudden drop in blood pressure and they might feel lightheaded, but that this is not an adverse effect. I saw this going out to parents so that you won't be concerned when you take your young one. So I wonder whether you know anything about that yet, or?
So I have heard as well from the other parts of the province that they are seeing, and this is fainting, essentially, with the younger group, and because we are in the schools immunizing for both HPV and Hep B and meningococcal vaccine, we typically see this in the younger age group. So I think we'll be prepared for it should it occur. And so far, because we're not there yet here in Peterborough, I mean, I would think that some of those appointments that are open today might be taken by 12-year-olds and above. We might start to see more young people, but it hasn't happened here yet. But I think we'll be able to deal with it should it occur.
Oh, that's so interesting. So this can happen with others, and it's not necessarily an allergic reaction or anything.
No.
Wow.
It's anxiety. It's more anxiety related. We see it in young people.
Wow. Okay, that's so interesting. Huh. All right, that's about all I have right now.
Okay, thank you so much, Joelle. Let's hear from our global news colleague. So Jessica Nisnik, if you've got some questions, go right ahead.
Thanks, Brittany. I do. Just a few for Dr. Salvatierra. Hello, Dr. Salvatierra. Will PRHC be using the COVAX booking system?
Yes, that's the plan, is that PRHC is going to be able to be part of the provincial booking system. So people will be able to book directly for a clinic there.
And there's no, is there any kind of age band or eligibility, or is it just open to everyone like the immunization clinic here?
It'll be the same. It'll show up the same as it does for any other of our clinics, whether they're in the city or the county.
Great. And okay, so the outbreak at Fairhaven was declared on the 21st, and it's a resident is isolating. Do we know how many others are involved?
I believe it's 2 staff people, Jessica.
Okay, on their website on the 21st, they said they had a resident isolating in a wing. But
Okay.
I'll just use that info from their website. And lastly, I know you just spoke about this, but I'm finding it a little hard to wrap my head around. We're going to be in limbo for 2 weeks. The stay-at-home order lifts and nothing is happening?
No, there isn't going to be a vacuum. You're going to be okay. Either the stay-at-home order will be extended if the indicators aren't where they need to be for us to come out of this lockdown. So depending on numbers of cases per day, how many are hospitalized, what the ICU admissions are like, that's going to determine whether or not that stay-at-home order is extended longer, or whether we might be ready to move to step 1. So there isn't going to be a limbo period. It'll be either an extension of the stay-at-home order if more time is required, or an introduction of the step 1.
Okay, that's good news, because nothing would be open and I think everyone would just be running around like a chicken with their head cut off. Like what? They're just so excited to be out, but there's nowhere to go. Okay, that's it for me. Thank you.
Great. Thank you so much, Jessica. Okay, last but not least, Greg Davis, do you have any questions for our speakers today? Oh, I think you were on mute, Greg.
Oh, sorry about that. Can you hear me now?
Yep, go right ahead.
What is the status, Dr. Salvatierra, on the other outbreaks? We have 2 daycares, 2 workplaces, and I'm also interested in the congregate living facility. That's now 44 days in outbreak.
Yes, I think we're hoping to be able to declare that congregate living setting over soon, Greg. And I did hear this morning that we've been able to declare one of those childcare settings over as well. So I think in general, the outbreaks are well controlled. We're not seeing, a lot of new cases, but with some of them, all it takes is 1 case. And then they get, in the situation where we're having to wait another incubation period, which is 14 days. So and that really explains the congregate living setting. It's sort of been a smoldering outbreak where there's been, 1 new case, and then that means we're looking at another 14-day extension before we can even think about declaring it over.
Just to follow up, how many cases have been associated with the congregate living facility? Do we know that number?
I don't have it, but we do have it, so we can get back to you with that.
Okay, perfect. That's everything for me. Thank you.
Okay, great. Thank you so much, Greg. And that brings us to an end to today's briefing. So thank you so much for joining us. And Greg, I will get back to you with that number for the congregate living setting. For everyone else, please stay safe out there, and we will see you back here on Friday at noon. All the best now. Bye-bye. Thank you.
Thanks, Brittany.
everyone.
Thanks, Brittany.